Persistent hyperplastic primary vitreous, persistent fetal vasculature. This is a congenital condition that is unilateral in 90% of cases, presenting at birth. Pathology: anterior type PHPV, microphthalmos, shallow anterior chamber, persistent vascularized pupillary membrane, cataract, and glaucoma. Anterior type persistent hyperplastic primary vitreous. Persistent hyaloid artery results in retrolenticular white fibrovascular band with stretching on ciliary processes. It is to be noted that PHPV has been reported in the same eye with retinoblastoma. Posterior type persistent hyperplastic primary vitreous. Vitreous membrane extending from optic nerve to the equator. Radial retinal folds. Abnormal macula and neural retinal detachment. Coats disease, retinal telangiectasia. This is a condition associated with retinal vascular anomalies, associated with exudative retinal detachment and capillary non-perfusion. Retinal telangiectasia is a unilateral disease, affecting males 85% in the first decade. It is non-hereditary with a normal anterior segment. Pathology of Coats disease: exudative retinal detachment, lipid deposits, hard exudates in subretinal space, refractile deposits, cholesterol in subretinal space. Vessels anomalies, more common in temporal quadrant, telangiectasia, venous dilation, microaneurysms, fusiform capillary dilation. Total retinal detachment, iris neovascularization, and hyphema. Retinal telangiectasia resulting in profuse leakage, patchy loss of capillary bed, no tumor mass, refractile subretinal particles which are less reflective than calcium. Ocular toxocariasis. This is ocular infection with Toxocara canis, visceral larva migrans. It is caused by puppies at home. Fever, pneumonitis, hepatosplenomegaly, and eosinophilia are present. Pathology: ocular affection. Anterior segment shows inflammation, keratic precipitates, and posterior synechia. Nematode endophthalmitis. Retinal inflammatory mass resulting in peripheral fundus gliosis. Severe vitritis with vitreous traction band, falciform ligament, tractional retinal detachment. Isolated granuloma, localized mass with discrete margins, umbilicated with retinal vessels dipping in the mass, retinochoroidal anastomosis. Fibrosis results in dragging of the optic disc. Retinal astrocytic hamartoma. This is a benign tumor of inner retinal layers originating from glial cells, astrocytes. Pathology: grayish-white smooth spongy mass with fuzzy margins. Mulberry glistening yellow-white avascular mass. It could be multiple. Types of retinal astrocytic hamartoma: solitary, systemic association with tuberous sclerosis or neurofibromatosis type 1. Retinopathy of prematurity, a potentially blinding condition in premature babies due to abnormal retinal vasculogenesis. Risk factors include low birth weight less than 1,250 grams, early gestational age less than 32 weeks, oxygen exposure. Prevalence: infant mortality rate less than 10 to 1,000 live births. Retinopathy of prematurity 6 to 20% of childhood blindness. Infant mortality rate 10 to 60 per live births. Retinopathy of prematurity emerging as a major cause of childhood blindness. Infants weighing less than 1,000 grams, 81.6% development of ROP. Infants weighing between 1,000 to 1,250 grams, 46.9% developed ROP. Severe disease is seen especially in babies under 26 weeks of gestation. Earliest form of retinopathy of prematurity is seen 4 weeks postpartum. Staging: The International Classification of ROP 1984 is based on three clinical parameters: location of disease, zones, proximity to optic disc, stage of vascular proliferation, and extent of involvement in clock hours. Disease location. Zones. Zone 1. A circle, the radius of which subtends an angle of 30 degrees and extends from the disc to twice the disc fovea distance. Zone 2. From the edge of Zone 1 peripherally to a point tangent to the nasal oris errata and the anatomic temporal equator. Zone 3. Residual temporal crescent of the retina anterior to Zone 2. The extent of the disease is specified as 30 degrees hours of the clock. Stages of vascular proliferation. Stage 1. Demarcation line. Stage 2. Demarcation ridge. Stage 3. Ridge with extraretinal fibrovascular proliferation. Stage 4. Tractional retinal detachment. Stage 5. Total funnel retinal detachment. Plus disease. Vascular incompetence. Dilatation and tortuosity of the peripheral retinal vessel. Iris vascular engorgement. Pupillary rigidity. Retinal hemorrhage and vitreous haze are other signs of advancing disease. Peripheral retinal changes. Incomplete vascularization. Abnormal straight retinal vessels. Retinal pigmentation. Circumferential interconnecting vascular arcades. Vitreous membranes. Equatorial folds. Lattice-like degeneration, retinal breaks, exudative, tractional retinal detachment, and RRD.